Hello, welcome to A Closer Look. I'm your host, Robyn H. Jimenez, and today we're going to take a closer look at Rose Gold Health PLLC. Our guest today is Ola Milkowski. Hello, Ola, how are you?
I'm good, Robin. Thank you for asking. How are you?
I'm great, thank you. Okay, so tell us, what is Rose Gold Health?
So we are a home visiting provider. So meaning that we send a doctor to the home to see the patient.
Okay, okay. And you started this business?
Yes, I
When did you
started
start?
I
Go ahead.
started Rose Gold Health 2022 is when I started the business officially. I've worked in home health for a while and saw such a huge need when it came to having strong providers that can serve patients that are not able to come out of their home as much and meet the needs, healthcare needs that they have. So we kind of bridge that gap and make simplify it.
So basically, what areas do you work in?
I see patients throughout the whole DFW. I can, if you're in Fort Worth, if you're in East Texas, I will see you wherever you are because I want to make sure that you're taken care of. So I
And
usually see patients every 4 to 6 weeks.
okay. And as far as how do they qualify, or how is this paid for?
Okay. So to qualify for the service, you have to be homebound. So Medicare's identification of homebound is that it's not that you can't leave the home. It's that leaving the home is you have difficulty leaving the home. As in you can go get your groceries, you can go do the basic go to church, go to your doctor's appointments here and there, your specialist, but you have great difficulty trying to make those doing anything further beyond that is, yeah, it takes a lot out of you. So that is the main thing that helps with the qualification for that, and everything is completely covered by the insurance.
Okay. And so what disabilities do you generally run into?
So it can be anything from I have chronic pain and it makes it harder for me to leave the home, arthritis, even just our elderly population have a lot of debilitation, meaning weakness, getting around. So really, over the age of 65, you're has a high probability you're going to qualify for it. And then on our younger population, it is then that's where we kind of start really fine tuning when it comes to disability is if we're seeing a kid is one with autism and with severe autism and difficulty, like severe anxiety trying to leave the home. Or the paralyzed or fibromyalgia, things like that, is kind of where we branch off when it comes to the younger population.
And what is your youngest patient or
Uh,
client?
My youngest one right now is she's about to turn 4.
Oh, wow.
Yes.
Okay. So
So
what all?
I'm
Go ahead.
family practice, so I see patients all the way from 3 years old up to 100 and whatever.
What all services do you offer?
So I like to put it in this term to make it easier is we bring the clinic to the home. So imagine if you're going to go see your PCP in a clinic, whatever they do there, we try to provide you at home. Everything from you're seeing your doctor, getting your medications filled, getting your referrals sent out, lab orders, they'll come to you to collect that imaging from x-rays, ultrasounds, whatever, they come to you and get that. If you're needing closer monitoring, let's say I need your blood pressure is out of whack or you just had a recent stroke, I'm going to get home health involved. So I'm going to get nursing out there. I'm going to get you physical therapy at home, occupational therapy, speech therapy. Everything's going to come to you at home. If you need assistance, let's say there's going on with housing or you need social work for advanced directives to get that and they come out to you and help you with those paperwork. We certain specialists will come out to the house and I'm always looking for more specialists that will make home visits. I have an ophthalmologist that'll come to the home. I have podiatry that'll come to the home. We try as much as possible to make it so that they come to you and you get that what you need right there at home. So you have no excuse not to see your doctors.
So it sounds like your service increases their quality of life as well as the quantity.
Exactly. The goal is to maintain your independence at home as much as possible. A lot of my patients don't want to go into a nursing home. They want to live in their home. They've lived in their home forever. They want to stay there as long as possible. And that's what I want. I want you to stay there. I want you to be safe there. And I want to prevent your hospitalizations as much as possible. And for me to do that, it starts with preventative care. And that is my huge focus. I tell everybody, if I don't know ahead of time what's going on with you and we don't catch it early, then there's nothing I can do about keeping you out of the hospital. So we got to work together. And you gotta follow, if I send a referral, that's because you need to see this person. You know, I don't want to if I don't have to. I know it makes it a lot harder for you, but I can't, I'm not an overall, I can't do it all. I need my village, I need my group. So if I need that specialist to see you to make sure that they're keeping an eye on that specific area. So we work together. You take the medications that are prescribed, you see that there the referrals that are sent out, and you let me know when there's any change. And that between all of that, we keep you where you need to be, right at home in the comfort.
That sounds good. What feeds your passion for this service?
I've started off as a nurse, and I have such a extensive history of a family history of nurses. And working in the hospital, I started off in the hospital, seeing a lot of patients come in and then they're discharged and they return back to the hospital. So that kind of led to my transition to home health. I wanted to follow them home. I want to see what's going on. Why are you coming back? What are we doing wrong in the hospital that leading you to coming right back? So a lot of what I saw in home health was that gap in the transition. So they're discharged and then nothing happens. They don't fill that med they're supposed to fill. They don't see their PCP like they're supposed to see. They don't follow up the referrals, the specialists that they're supposed to follow up with. So the home health helped me kind of guide and try to make that happen a little easier. And then I went back to school, got my MP because I wanted to get even more involved. Like I want to make sure that you are completely covered everywhere I see a gap because I did see a slight gap. I hear a lot of, I feel like another number when I go to the clinic. It's a rush, get me through. And so it takes a lot for a patient to build that relationship, that trust with you. I wanted to sit down with them and I want to see everything that's going on because I can't help you if you don't trust me enough to tell me everything going on. So this helped me after I got my degree, I literally was just awful because I met so many amazing people that um, have house call clinics that go out and see patients that it just helped me so much in starting my business and transitioning into that role was almost seamless. It was just, I'm still me, but now I can do more for you. So, yeah, I get to sit down and I get to finally do it all. I am still a nurse at heart, but now I can be your doctor as well. So I'm still gonna sit here and listen and hear everything, and then we're gonna plan. And we are gonna write it out. You're gonna know exactly what the plan is. I'm gonna make sure that you are able to, you are very much involved because it's not me. I can tell you 100 days, 100 times to do this, you're not going to do it. So I want you involved. I want you to talk to me. I want to see what is it that's going to prevent you from doing it so that we can come up with a plan that you are able to follow. And then I'm going to see you again in a few weeks and we're going to see where we're at with that plan. So it literally, my, it has been my passion for ages and I feel like it just keeps on growing. I just keep seeing more and it's massive. Healthcare is massive in its growth and its changes and it's so excited and I get to grow with it as the business gets bigger and as I see more and more clients.
Okay, so I have to ask you, what is your favorite part of this business?
Goodness. Okay. I was actually thinking about that the other day and it is my absolute favorite part is working with the patient to figure out what is going on with them, managing it, and seeing them just recover so well, even beyond what they thought they could do. That is, and just that is everything to me. Because we go back to look at where we started. You could barely walk. You just had this just happened. Everything, you didn't know what you were supposed to be on. You didn't know what you were supposed to take. And look at where we're at now. You're on a treadmill. Like, you're doing so much better. You're making your meals. It is everything to me. Or the ones that um have been they go to this specialist and they managed this specific thing, and they go to this one, and it hasn't really come together as in why this part of me is causing this to happen. It's like everybody's treated different parts, and it hasn't really come together. So when we bring it all together and realize that this is triggering this, and then we by you understanding how your system works and what is causing this, you take control. And that is so important to me. You take control of your health, because I know how to prevent that from happening now. I know that if this is if I feel this, or if I see this, this is what is going on with me, and this is how I can prevent it. That saves so much lives, and just empowers so many people. Just know that knowledge. So that is my favorite part, is just impacting that knowledge and seeing the change happen.
For someone who is, or they may be noticing that that things are changing and they need a little bit extra help or a lot of extra help,
Mhm.
but they don't know how to get started. How do they get started
So
with your services?
it's as simple as giving me a phone call, telling me you call me and tell me kind of what's going on, and I find out what insurance you have, because I want to make sure that if I'm seeing you, it's going to be completely covered by your insurance. So I run eligibility, and if everything is good, I'm going to talk to you, and we're going to kind of do an intake kind of situation and get the preliminaries in, and then I schedule out a visit to come and see you for our big first visit to see what direction we're going. It's literally a simple phone call.
Okay, that sounds awesome. I know that there will be people out there that have been wondering, what do I do now? Because that transition can be a little scary.
It is, yes.
So, how do people get in touch with you? As far as phone, email, social media, you know, how can
So
people get in touch with you?
I tell a lot of my elderly population are not very technologically savvy. So a phone call is always the fastest and easiest way. There is the business line, and there's my personal line as well, that you can call, and that will get us right to start at. For those that need are a little bit more technologically savvy, you can email me at Rose Gold Health PLLC at yahoo.com, and I will respond right back to you. The number to get in touch with me is 682-554-6246.
Okay, can you repeat that number one more time?
Yes, it's 682-554-6246.
Okay, awesome. Great. I hope that the people that need to reach you will be able to see this and, let you go into their lives and bless them, because I know just from talking to you before, that you are very passionate about this. So thank you
Yep.
so much for your time. Is there anything you want to say in closing?
Just but thank you so much for giving me the opportunity to reach out to as many people as possible. And even understand that even if you don't come to me, even if you're in different states, this service is provided everywhere. You can look it up and find out what service or what provider is closest to you, so that you can get something started and are not sitting here thinking that there's nothing else I can do, that basically nobody cares, or I'm being missed. I'm missing out on things that I need for my health. It is everywhere. Just look up at your local area or call me, and I'll happily help.
Okay.
And oh, also, if you do call me and I don't accept your insurance, I will happily guide you to somebody that does.
Oh, awesome.
Mhm.
So, well, thank you so much for coming and talking to me real quick and talking to our audience. Um, I appreciate your time.
All right. Thank you so much, Robyn. I appreciate you too.